This model focuses on the implementation of administrative, environmental, and engineering controls at healthcare facilities. At the end of this model, you should be able to describe healthcare system requirements for IPC and isolation precautions. Describe the hierarchy of hazard controls and their application for COVID-19. The following are healthcare system requirements for isolation precautions. All healthcare facilities in Nigeria must ensure that they have an IPC program with policies and procedures based on sound epidemiology and best practice. All healthcare workers in the health facility should be correctly trained on the basic IPC procedures and should be able to implement standard precautions as well as droplet, contact, and airborne precautions. Isolation facilities with appropriate ventilation systems should be provided for suspected and confirmed COVID-19 patients, and the patients should be placed appropriately in these facilities. The facilities should have appropriate infrastructure to contain the spread of infection, such as physical barriers to separate patients and closed suctioning systems for airway suctioning for intubated patients. PPE must be provided for all health workers and should be used appropriately. Please note that the components above work together and must be implemented to ensure that efficient IPC measures are employed. Now, let us look at each of these components in detail. The following administrative controls are important. Adequate training must be provided for all healthcare workers in the health facility. Monitor healthcare workers' compliance with standard precautions and provide mechanisms for improvement as needed. Establish a surveillance process for acute respiratory infections potentially caused by COVID-19 among healthcare workers. Ensure that healthcare workers and the public understand the importance of promptly seeking medical care. And ensure adequate patient-to-staff ratio. These controls address the basic infrastructure of the healthcare facility. Ensure that there is adequate ventilation in all areas of the healthcare facility. Spatial separation of at least 1 meter should be maintained between all patients. Both spatial separation and adequate ventilation can help reduce the spread of many pathogens in the healthcare setting. Adequate wash infrastructure should be provided and environmental cleaning using the appropriate cleaning and disinfection procedures should be done consistently. And laundry, food, and medical waste should be safely managed according to the recommended safe routine procedures. Risk assessment based on potential exposure and risk must be carried out before donning PPE. Proper hand hygiene must be carried out before donning PPE and at all times as appropriate. Remember the 5 moments for hand hygiene. All PPE must be worn and removed properly using the correct techniques for donning and doffing PPE. After removal, all PPE must be safely disposed of in a designated receptacle or waste container. On the hierarchy of hazard controls, the most important control to be implemented is the administrative control, followed by the engineering and environmental controls and the appropriate use of PPE. Please note that this does not mean the engineering and environmental controls or the use of PPE are unimportant. It is crucial that the appropriate PPE is used by health workers that care for COVID-19 patients. As mentioned earlier, these controls must be implemented together to ensure effectiveness.